Welcome. One of the great challenges for all clinicians, I believe, is how do you maintain your passion, your excitement, the enjoyment of practicing dentistry over a career that may last 20, 30, 40 years. And so what I'd like to do in this lesson is talk to you about that process. And really, for those of us at Spear Education, it comes down to asking a pretty simple question for every student who comes here. And that is, how would you change your practice so it's more fun for you, it's more profitable for you, you have time away from dentistry if that's what you want while maintaining your profitability, and you grow clinically to whatever level of excellence that you desire. In order to help dentists understand that, and specifically I'm talking mostly right now about general practitioners, we've come up with a pyramid that helps explain sort of what a general practice functions like relative to the different patients that are in your practice. And so really the pyramid represents the values these patients have for dentistry. Not that they're good or bad, right or wrong, it's just this is what is. So what I'd like to do is walk you through the pyramid, and as I do it, ask yourself as we talk about each of these groups of patients, how they would impact you relative to those questions I posed. Would they help make practice more fun for you? Would they make it more profitable for you? Would they help you grow clinically? So the one thing we know for almost all practitioners is there is going to be a group of patients who require urgent care. And they may be your existing patients, they may be new patients. We'd certainly like to minimize the number of emergencies typically, simply because they really don't add to that fun factor, the profitability factor, and they really rarely help you grow that much clinically. So we'd prefer not to have a lot of emergencies in our practice. We do have in most general practices a group of patients that we would label as being reactive in their value for dentistry. And what I mean by that is quite simply that they really only want dentistry done when it has to be done. They're hurting, for example, something fractured. And they may come in, see you, want that one tooth taken care of. You look at the adjacent tooth and you say to them, if you don't do anything, that tooth's going to be in the same condition. And they're like, that's okay, I'll wait till it breaks. Again, if you ask the question, how do these people relate to those goals of having more fun in practice, being more profitable? Reactive patients typically take away from those things. So again, we'd like to not have a practice full of reactive patients. Now let's move into really the patients we'd like to have a fair number of in general practice. We label them as proactive because in fact they value dentistry, they value their teeth, and they have a desire to avoid negative consequences. They come in for recalls, they get their hygiene appointments done. If you say to them that there's a cracked tooth with some decay, they want you to treat it because they don't want the consequences of not treating it. Now, the reality of life is in the proactive world, most of the dentistry done tends to be single tooth dentistry, perhaps a couple of teeth. It also may be that the proactive patients tend to be fairly insurance sensitive, fairly fee sensitive, but it's a great patient for a general practice. In fact, you'd like a really strong, solid base of proactive patients because it helps support your hygiene department. The hygiene department grows with the patient numbers. They also get to talk to the patients about problems every 6 months that were diagnosed at the initial exam, and those patients ultimately then often come back and do some of that dentistry. Now, in reality, in the proactive world, there are differences among the patients who live in that box. Some of the patients might have PPO plans that ask you to discount fees extremely. Some of these patients may be fee for service. But for the most part, for now, let's just discuss the concept that yes, we'd like to have a good foundation of proactive patients in our practice. The problem is they're not very exciting. So they tend to not add a lot of enjoyment to practice. And single tooth dentistry over and over for 20 years also doesn't help you grow clinically very much. So really what we've learned and what I've learned in 30 years in dental education is the top two boxes on the pyramid are kind of where the excitement lives. The proactive base is great for financial security. It's great for profitability. But we'd like you to have some patients who live in the top two boxes. The next one up we'll call discretionary. Discretionary patients really are motivated typically by appearance. They choose to do dentistry that's not necessary, but they choose to do it because they want to look different. They'll do bleaching, they'll do bonding, they'll do ortho, they'll do veneers. The funnest part about discretionary dentistry is the patients want it. Proactive patients would rather not have the dentistry. They do it to avoid consequences. Discretionary patients, they want the dentistry. And there's a big difference if you're the dentist when you're providing care to somebody who wants to be in your chair as opposed to somebody who feels like they have to be in your chair. Now, the other good part about discretionary care, it's almost always all fee for service. So you will get paid what your normal fee is. You're not going to have to write off anything because of insurance discounts. And then finally, at the top of the pyramid, we have what we would describe as regenerative patients. And they're patients that basically will do anything. They just have reached a point in their life that they want their mouth taken care of. They'll do jaw surgery, ortho, implants, you name it. They're very exciting patients to work with. So what the regenerative and the discretionary patients do for general practice is they add excitement and they add profitability. And they help you grow clinically because they challenge you. Now, in truth, back in the 1990s, when cosmetics was more in its infancy, the goal typically was to have a discretionary practice. People wanted a boutique practice. That's a really tough model of dental practice, and that's not a model that we would typically recommend. A much better model is to grow a strong proactive base and then figure out how to get to see 1, 2, perhaps more discretionary or regenerative patients a month. You don't need a whole practice full of them. If you can get it, it's great, but that's not really the model that we're looking for if we want a robust hygiene department and a nice, secure financial base for your practice. Now, what I also want you to realize is it's important for you to understand that the patients have motivations for why they're coming in. So really reactive patients, they do dentistry because they have to. The proactive patients do dentistry to avoid negative consequences. In both those groups, they would really rather not be in your chair. The discretionary patient, as I said, it's different. They do dentistry because they want to. And the regenerative patient's the same. They do dentistry because they want their mouth taken care of. The other thing I can tell you about the pyramid is there's a line that lives right in the middle between proactive and discretionary, and that line really is dental insurance. Pretty much everything above the proactive base is not insurance driven at all. It's patient motivated. The patient wants the dentistry. And in practice, if you want practice to be more fun and more profitable and you want to grow clinically, the more you get to do dentistry that's above that line, the more fun you typically have and the more profitable your practice is. Now, one of the challenges of all of this is we often hear dentists talk about trust and value. And they'll say, well, I'd love to do more of that dentistry, but I got to get patients to trust me first. I have to have a relationship with them. And you know what I tell students in the workshops here when we start is, isn't it interesting that from the insurance line down, as long as your treatment plan is below what the insurance pays, it's amazing patients trust you. You basically, because you have a name that says DDS or DMD, as long as they don't have to pay out of pocket, they trust you. And whatever you propose, they'll value it because they're not paying anything. What I do want you to realize is when we get to the discretionary and regenerative care, then trust and value are different. It's a different level of trust that's required. It's a different level of perceived value that's required. And I will tell you my personal bias is it's not how long you've known somebody, it's not how many times you've seen them that creates that higher level of trust and value. It's how you help patients understand what to expect and the experiences you create for them that creates that higher level of trust and value. And it can happen in a very few appointments. It can happen at the initial exam appointment and perhaps a subsequent consult if the experience you create is significant. So what I hope you get out of this is you get a picture of what your practice might be like. A typical general practice, yep, we want you to have that strong proactive base, but we want you to find those other patients. We want you to find those discretionary and regenerative patients to add to your excitement, your team's excitement. So in the past, In the early 90s, mid 90s, sure, we would have said, so the goal basically is let's have an aesthetic and reconstructive practice. And in fact, a lot of people think that's what spirit education's about. It's just about complex cases. And not at all. We really have a picture of what we believe a robust, healthy general practice looks like. And what we want to do is grow your clinical skills and help dentists achieve the ability to treat these patients. This happens to be a retired dentist who's decided he wants all of his dentistry redone. He has some caries that's to deal with, fractured porcelain. And sure, I want to be able to treat him if he comes in, but no, the answer is I don't want you to think that your whole practice is going to be complex restorative dentistry. Now, in his case, it's wonderful to help this patient achieve his goal, which is primarily a discretionary goal. He wants to look better. He wants the broken porcelain fixed. He's decided he doesn't like the gold. And so he was treated with some implants in the lower posterior, upper reconstruction, removing all the old broken restorations and cleaning out the caries. Same thing on the other side. And yeah, we want you to know how to do this kind of dentistry when it presents. We want you to know how to talk to these patients and help them grow. But the place a general practice can really grow is to realize that within what you perceive as proactive patients lives a lot of discretionary and regenerative care. And so there are some patients already in your practice who would do some of this dentistry if they knew it was possible. And there's also the reality is that within your proactive patients, you can have a huge impact on your profitability and fun by realizing a lot of those patients would do dentistry that you might not believe they would do. It may not be high-end, fancy, complex dentistry, but they would do more than you believe they would do. And I'll just share with you a couple of examples in a second from a general practitioner named Jill Hansen. And what Jill's learned is really clear. She shares with all of her patients possibilities, not treatment plans, possibilities. So even if she believes that that patient may be just a proactive patient, they're never going to do the complete reconstruction, they're never going to do all the complex dentistry that might be ideal for them, she shares with them the possibilities of what dentistry can offer them. And the goal is to share possibilities so that those patients share with you whether they'd like to investigate them or not. So just a couple of patients from Jill's general practice. Male who came in, has got worn teeth, for some fractured restorations, unesthetic, and he's really not aware that there's options that could be done relatively conservatively that would help him. Jill spent enough time with him to share the possibilities of how many of these teeth could be managed simply with composite bonding and reshaping. Yes, the maxillary anterior teeth, the incisors might benefit from some indirect restorations. And so here's the patient prior to treatment, and here's the patient on the right. Jill has equilibrated the patient's bite, done composite on the lower anteriors, equilibrated the anteriors to a nice level occlusal plane, prepped the maxillary incisors and has provisionals on them. And so basically this patient got an equilibration, some composites, and 4 anterior restorations. And this is a patient who'd been in another practice for over 20 years and was never informed that those kinds of possibilities exist. And so sure, you could have made a case to do a lot more dentistry on him, but this is really an excellent result. Patient's happy, Jill's happy. It's exciting for Jill and her staff to perform treatment like this for a patient like this. That's what we're talking about. A patient who's perceived as really just a proactive one-tooth patient who in fact is willing to do more when he's informed of the possibilities. And then one more example from her practice. A patient who came to her as a new patient who'd missing a lower left first molar. Patient hadn't replaced the first molar because the patient was told that they would have to have a bridge, and the bridge was going to involve that second premolar. Patient didn't want that second premolar touched. Jill talked to the patient about the fact that you don't need the bridge, we can do implants today, and the patient does a very nice single tooth implant restoration. Again, a proactive patient who stepped up and did really ideal treatment, just not on a lot of teeth, but it's a much more fun way to practice. It's a more profitable way to practice. It's far more exciting for both you and your team, but it's also better for the patients in the long run. So I hope the SPEAR model makes sense to you. As I said, it's not a model that says we want you to have a complex reconstructive practice. It's a model that says we want you to know how to do the best dentistry that you desire, and then we want you to know how to interact and communicate with your patients to see who wants to step up to those higher levels of the pyramid. But even within the proactive level, let's grow those patients so they know what possibilities exist. I've enjoyed sharing this with you. Thanks.